Now, health workers involved in providing care for people with COVID-19 have lamented the intense pressure they are having to endure following the resurgence in the number of cases in recent weeks. They tell Joynews they fear they could buck under pressure if the cases continue to mount. The resurgence has been blamed on the general lack of adherence to their preventive protocols, such as wearing of masks. Joynews' Beryl Ernestina visited the COVID-19 center at the Kolebu Teaching Hospital and report the health workers are appealing to the public to take care of themselves so they don't get infected.
The condition of COVID-19 patients on admission at the Kolebu Teaching Hospital has become critical and needs specialized attention. Health workers at the treatment center brace themselves for the task ahead.
And this ambulance is ready to transport a critically ill COVID patient to the intensive care unit for proper management and care. The nurses and other health workers here at the COVID unit of the Kolebu Teaching Hospital are getting ready or packing everything that the patient will need when he or she is admitted at the intensive care unit.
Prosper Pobi is a senior public health nurse and a member of the COVID-19 case management at the Premier Health Facility.
We currently have 4, and out of the 4, 3 are currently on oxygen. 1 is not. And out of the 3, 1 is in critical condition. And so my colleagues are just preparing to take him to the medical intensive care unit for continuity of care.
He is worried about the increasing cases of COVID-19 cases at the treatment center.
In the last 2 weeks, we've realized that there is a surge in the number of COVID cases we recorded in the facility. This involves patients who are currently on admission and then relatives who are coming from home just to be screened. This is a treatment center. So all the cases we have here are already positive. You have to record a positive test to be brought here. So from the beginning of the week, we had 7 positive cases here.
Over the past few months, health experts have expressed concerns about the disregard for the COVID-19 safety protocols by the public. Many attribute the non-adherence to safety protocols to the current increase of cases. Senior public health nurse Prosper Pobi says health workers are under extreme pressure.
I want them to also note that the energy with which health workers started this fight is no more like that. We are getting tired. Some of us have not had our leave for the past 12 months. Currently, as we speak, I know 2 staff of the department who are currently self-isolating because they've tested positive. One even had a son contracting the disease because when we screened the family, the son tested positive. So yes, it's real. Some of our colleagues have been testing positive and some are still positive. But by the grace of God, we've not lost any life yet.
Dr. Dennis Tete is one of the medical officers at the intensive care unit of the treatment center. According to him, the unit currently has 2 patients on oxygen.
So currently we have 2 patients on admission, all on oxygen, fairly stable, doing well. So that's where we are now.
And at what conditions were they brought here?
Okay, so they were all brought in a state of respiratory distress. One had comorbidity, the other was fairly fine till he started deteriorating gradually. So you had to put him on oxygen.
For frontline health workers like Dr. Dennis Tete and Prosper Pobi, they would continue giving off their best, but they have a caution for Ghanaians.
Yes, COVID is not gone, it's still with us. So my advice to them will be to adhere to the protocols and try and stay safe for themselves, for their families, and also for us. We've had 1 mortality this week here. That's our fight.
The general public should note that COVID is still real and it's still killing.
As the battle against COVID-19 rages, you hold your fate in your hands by observing the safety protocols. Beryl Ernestina Richter's report for Joynews.